Okay, we have enough time for one more question. It's from Jim. What causes back pain and what are the therapies? Jim's trying to get off cheap. We have a 3 webinar series on that. But, I'll try to answer the best I can in the 5 minutes we've got. So, first of all, the load is on all of us. No one gets out of this life without some back pain. We're standing up, our backs take all this weight and all this pressure. It's the number 1 cause of disability in the United States. Okay? Back pain is complicated. It's extraordinarily complicated. There's biodynamics. There's all kinds of mechanics. But we're going to try to answer that question pretty quickly. I think the best thing to do is go over spinal anatomy. It'll help you understand the causes and therapies to a certain degree. So let's all go over that. And let's first start off with the understanding that from the day you're born, your back gets worse. It's a downhill slide. Age, weight gain, work, forces on your back, all of that leads to some instability and some bony spur formation, some osteoformation. Remember, bones, when they get put pressure on, they get bigger. They build bone. So you get these spurs that build up, especially as the disc fail and all that. We're seeing an epidemic in back pain, and I'll give you a few of the reasons. One, the kind of work people do, which is changing a little bit. 2, the weight problem, the obesity problem is really huge now. 3, which is related to the obesity problem, not staying physically fit, wasting away a little bit, not working out. Another one is we're getting older, aging process, and also, realistically, money is an issue. If you've been working hard all your life and you get back pain and you got to get off work and maybe some retraining and a little money, it means something to you. So there are probably people out there that get back pain for real and unconsciously or consciously decide, well, I'm going to keep saying I have back pain. And I never saw too many of those folks, because if you got to me, you had serious problems. But I've heard that this really is a problem. But I think that the 2 major problems are the obesity problem and the not staying healthy and exercising issue. Now, I'm just going to pull out my model here and show you the things that go wrong. Now, first of all, muscle and fascia can go wrong. Okay? Now, we're talking just about things that go wrong in the vertebra and the disc and spine area. There are a lot of other things that can cause back pain that we can go over, but we don't really have time. So I'm going to go over the big 3. Muscle fascia can cause problem, but the big 3 are disc, nerve, facet. Okay? The disc can get compressed. It can herniate. I'm showing you right here on the model. Okay? It can push out right into this little area where the nerve comes out and push on the nerve. And as it degenerates, the osteophytes or facets, the facets can build osteophytes or spurs, and they can push into that nerve canal, and it can cause nerve pain by pressing that nerve, not letting it slide, not letting it move, and pressing directly on it, and causing inflammation. This whole area can get inflamed from various processes. So the disc, which is supposed to be the nice little cushion, can start failing, herniate, degenerate, and it degenerates as you get older. The bones, the facets, can build up bony spurs, and it naturally builds these osteophytes up over time as you age and the pressure is put on and the discs degenerate. And then the nerve can get compressed. Those are your big 3. Now, how do you treat this? Well, for most people, which the majority of us are going to have back pain at some point in time, relaxation, rest are important. If you have a more serious injury, activation is important. You want to get activated right away on all back pain. Early activation is important. Exercising and strengthening is very important. Meds are helpful to minimize your pain and get you active and rescue you from more severe pain. Weight loss is important. Relaxation therapy and coping skills is important. Surgery and procedures, for most people, not needed, but for disc herniation, vertebral collapse, and some of the more serious disorders, very much needed. And if you want to hear about them more, you're going to have to go to the webinar. You hear me, Jim? All right. That's it for today. Tomorrow we start off with the herbal therapies. I'll see you then. That's the end of today's webinar. Thanks for coming.